Cancer of the colon and rectum is a very common disease process. It's actually becoming one of the most common diseases in patients under 40 in terms of causes of cancer. Usually, for most types of colon and rectal cancer, starts on the inside lining of the colon or rectum and then slowly grows deeper through the layers of the wall as time goes on. One of the things to know about colorectal cancer is that we often put it all under the same umbrella, but colon cancers are actually diagnosed and treated slightly differently from rectal cancers. Rectal cancers may, in certain situations, need chemotherapy and radiation before surgery, whereas colon cancer very rarely has any treatment prior to doing an operation. While colon and rectal cancer can be asymptomatic for certain patients, and those patients may find out during a routine screening colonoscopy that they have a problem going on, oftentimes there are signs. First would be any abdominal pain, any rectal bleeding, pain with bowel movements, and any change in bowel habits, so unexplained constipation, diarrhea, or difficulty passing stool. Minimally invasive surgery is becoming standard of care for the vast majority of patients. One of the main benefits of minimally invasive surgery, either laparoscopic or robotic surgery from the perspective of the patient, is much faster recovery compared to conventional open surgery. Oftentimes our patients stay in the hospital around 48 hours after a minimally invasive surgery, whereas in the past with conventional open surgical techniques, patients may be staying in the hospital up to a week after surgery. One of the most important things for patients to know is that colorectal cancer is becoming more and more frequently diagnosed. However, it is very treatable, particularly when found early, so it's very important that patients are getting screened with colonoscopy, usually starting at age 45, but sometimes even earlier depending on symptoms, personal or family history.